School Clinic Orientation, what you need to know. Today, our objectives include defining school nursing practice, apply school nursing standards and practices, and operating in the health office or clinic safely and competently. The National Association of School Nursing defines school nursing as a specialized practice of nursing that protects and promotes student health, facilitates optimal development, and advances academic success. School nurses are grounded in ethical and evidence-based practice, are leaders who bridge healthcare and education, provide care coordination, advocate for quality student-centered care, and collaborate to design systems that allow individuals and communities to develop their full potential. The current framework developed by the National Association of School Nurses is the framework for 21st century school nursing practice. The framework provides structure and focus for evidence-based school nursing practice, key principles, and components. This framework aligns with the whole school, whole community, whole child model, which calls for a collaborative and coordinated approach to learning and health. The purpose for standards of practice for school nurses is to establish a minimal acceptable level of nursing practice in any setting. Standards are set by each state's BON and nursing specialty organizations. School nurses also follow the school nursing specialty standards set by the National Association of School Nurses and the American Nurses Association. The ANA and NANSEN standards describe the duties that school nurses should competently perform. The school nurse and clinic staff serves as a bridge between health and education and must understand the legal aspects of both systems. School nursing practice, built upon ethical foundations, is grounded in the NANSEN core values of child well-being, diversity, equity, inclusion, excellence, innovation, integrity, leadership, and scholarship. NANSEN states that school nurses face unique legal, policy, funding, and supervisory issues. Examples include unsafe school nurse-to-student ratios, accountability for care delegated to unlicensed assistant personnel, school administration requests to amend documentation, school administrator assignment of nursing tasks to UAP without the input of the school nurse, and parent-guardian requests for medical treatment for his or her student inconsistent with the school nurse's scope of practice. We currently have federal laws related to school health services that must be followed. One of those policies is called the Local Wellness Policy. It's a federal law that requires any school district or local educational agency in the National School Lunch Breakfast Program to establish a local school wellness policy for schools under its jurisdiction. The school policy promotes student health and outlines district-level goals to establish, evaluate, and maintain a healthy school environment. The Health Insurance Portability and Accountability Act, also known as HIPAA, requires covered entities to protect individuals' health records and other identifiable health information. The Federal Education Right to Privacy Act, or FERPA, also applies to educational agencies and institutions that receive funds under any program administered by the United States Department of Education. The Americans with Disabilities Act defines a person with a disability as a person with a physical or mental impairment that substantially limits one or more major life activities. Public school districts must provide free education in an integrated setting where possible. Schools must provide accommodations for individual educational needs, such as modifications to the school day, assistance with healthcare, and technology. Individuals with Disabilities Education Act, or IDEA, ensures children with disabilities receive special education and related services. Section 504 of the 1973 Rehabilitation Act protects the rights of individuals with disabilities in programs and activities that receive federal financial assistance. In Texas, school health services staff need to know school health related laws, rules, and regulations to assure the health and safety of students. Some of these laws include campuses remaining alcohol free, child abuse reporting, coordinated health program for elementary, middle, and junior high students, a do not resuscitate policy, dissemination of bacterial meningitis information, e-cigarettes and tobacco on school property, immunizations, self-administration of asthma, diabetes, and anaphylaxis medications, and steroids. Texas is a local control state, meaning an elected board of trustees runs each school district. School board administrators develop administrative rules to implement the school board policies. The Texas Association of School Boards assists and represents local Texas school boards by offering timely, expert, and economic development of policies. Texas school health requirements. Each school year, the Texas school districts must have instruction in CPR and AED on the principles and techniques of CPR and the use of AED for district employees and volunteers. Students also receive CPR and AED training according to the Texas Administrative Code Title 19, Section 74.38, requiring that students in grades 7 through 12 must receive CPR training, hands-only CPR, and the instruction must include training developed by the American Heart Association or American Red Cross or nationally recognized evidence-based guidelines for emergency cardiovascular care. Training may be provided by the school RN. School campuses are also required to maintain AEDs. School districts must comply with the Texas Health and Safety Code, Section 779.001, and Texas Education Code, Section 38.017, regarding the use and maintenance of AEDs. Texas school districts are also responsible for child abuse reporting. The Texas Family Code Section 261.101 mandates that anyone should immediately report child abuse or neglect. School districts work in cooperation with agencies on child abuse reporting. School districts must have a crisis management team. The Texas Education Code Section 37.108 requires each school district to adopt and implement a multi-hazard emergency operation plan for use in the district's facilities. The plan must address prevention, mitigation, preparedness, response, and recovery. Bloodborne pathogens and exposure control plans must also be included in every school district in the state of Texas. These are to help decrease the exposure to bloodborne pathogens among students and staff. School districts must have a bloodborne pathogen control plan in place. Each school year, Texas school campuses are required to send a notice about bacterial meningitis to students' parents and legal guardians. The notice must explain the cause, symptoms, preventions, transmission, and resources on bacterial meningitis. Schools may meet this requirement via the student handbook or website. Texas campuses also discuss the communicable diseases located in the Texas Health and Safety Code 81.041 and Texas Administrative Code Title 25, Section 97.1 through 97.3 discuss the control of communicable diseases in Texas. The Texas Medication Administration and Civil Immunity Policy states that according to Texas Education Code Section 22.052, districts may assign staff to administer medication to students if the district adopts a medication policy and secures written parental permission. Texas campuses also should have a steroid law posting policy in place, according to Texas Education Code 38.008, prohibiting possession, dispensing, delivering, or administering an anabolic steroid by any means not allowed by state law. Each school district with a grade level of 7 or higher must post a steroid law notice. Unlicensed diabetic care assistants are supported by the Texas Health and Safety Code 168.004, requiring the principal in each school to assign a school employee who are not healthcare professionals to serve as UCA-trained staff. Each school campus must also have a head lice policy in place, according to the Texas Education Code, Section 38.031, requiring all school districts to adopt a head louse policy for elementary schools. The Texas required school health trainings for staff include automatic external defibrillator, every nurse, every athletic coach, PE teacher, band director, and cheerleading coach. For CPR and first aid, district employees who serve as director of a school marching band, head coach athletics, including cheerleading. Steroids, each employee who serves as an athletic coach at or above the 7th grade level. For concussion training for employees, a coach of an interscholastic athletic activity, the school nurse who serves on the concussion oversight team. In the coordinated health program, for employees, the district determines necessary to implement TEA's coordinated health program. Each campus must have a bloodborne pathogens policy. Employees who provide healthcare-related services or otherwise have a risk of exposure to bloodborne pathogens must receive this training. Food allergy training. This includes specialized training for certain employees, awareness training, and general training for other employees. Diabetes training is specialized training for certain employees, awareness training, and general training for others. Seizure recognition and related first aid training are for school nurses and district employees whose duties include regular contact with students. Traumatic injury response training, Stop the Bleed, includes staff who are school security, school resource offers, and all other district personnel are expected to use in a bleeding control situation. Vision and hearing screenings are mandated by the state of Texas. Children aged 4 years old by September 1st, kindergartners, and any first-time entrants K through 12 within the first 120 days of admission must receive a vision and hearing screening. 1st, 3rd, 5th, and 7th grade can be screened anytime within the school year, preferably within the first 120 days of school. Vision and hearing training is offered through DSHS at Region 12. For spinal screenings, girls are screened 2 times at age 10 or fall semester of 5th grade and age 12 or fall semester of 7th grade. Boys are only screened 1 time at age 13 or 14 or fall semester of their 8th grade year. An RN does not have to be trained for spinal screening. Immunizations are mandated in the state of Texas. Please review the 2025-2026 Texas minimum state vaccine requirements for students grades K through 12. When parents do not want their student to have vaccines, they are allowed to complete an exemption or an affidavit requiring that their students are immune from vaccines in the state of Texas. Please visit the Department of State Health Services website for more information on conscious objections and affidavits. Texas law requires local school boards to adopt a medication administration policy before medication can be administered to students. Administrative regulations outline the specific details that are to be followed in administering medication to students. The superintendent or designee develops the regulations. Parental consent must be obtained once the medication policy and regulations have been adopted. The school can seek permission from parents and guardians for medication administration. Many medications can be administered at home. Therefore, parents and guardians should consider administering the medication before or after school. If it's necessary to give at school, the nurse or principal's designee is responsible for medication administration. Medications must be received in their original, properly labeled container and must come to school in the original container with the date of the filling, pharmacy name and address, prescription number, name of the patient, name of practitioner, directions for use, and any cautionary statements. Over-the-counter medications must arrive at school in their original properly labeled container. Parental consent should be provided using the medication administration authorization form and brought in by a parent or guardian. Herbal medications or dietary supplements are not evaluated by the FDA, and it is recommended that complementary and alternative medicine be written into the Individualized Education Plan or 504 plan and accompanied by an MD order. Medication errors are preventable, but if an error occurs, the student should remain in the health room, observe the student's status, and observe what you see. The nurse should identify the source of the medication, notify the principal and school health services, contact poison control if necessary, notify parents, and complete the medication error form. According to Texas Education Code, Chapter 38, Section 38.015, students are allowed to care for and self-administer prescription asthma or anaphylaxis medication. Health and Safety Code, Chapter 168, Section 168.008, allows students with diabetes to self-carry and administer medications to manage their condition. In an emergency situation, schools should be ready to administer emergency care. When drafting emergency medication policies, schools should consider emergency medication administration across all school-related settings. Each school should provide the name, phone number, and general location of the school nurse or trained school health staff on campus who can administer emergency medications. Texas Education Code, Chapter 22, Section 22.052 directs that school personnel may administer medication as long as they abide by the district's medication policy and administrative regulations. Only the necessary doses of medication should travel off-site along with a copy of the parental medication authorization form. Texas Administrative Code Rule 217.11 are the standards of care that all licensed and registered nurses must comply with in practicing nursing in Texas. Standard 217.11 requires nurses to know the rationale and effects of the medications and treatments they administer to students. If the nurse is unsure of the dosage or effectiveness of the medication, they must seek clarification from the student's prescribing practitioner. The general procedures for medication administration include making sure that you have the right patient, right drug, right dose, right route, right time, right documentation, right diagnosis, and right response. Make sure medications are stored appropriately. It is recommended that each school have storage policies and administrative regulations in place for storing medications such as locked cabinets or drawers or locked refrigerators. Locked medication storage should be limited to designated school health personnel. Refrigerators should be monitored with temperatures between 33 and 45 degrees Fahrenheit. Staff should follow hand washing protocols before and after handling medication. Avoid touching the medication. Avoid cutting, crushing, or changing the dosage of the medication. Score tablets that must be cut in half to obtain the smaller dose should be cut by the school nurse or a licensed healthcare provider. Liquid medications should be followed by the directions on the bottle. Measure to ensure accurate dosage. A marked medicine cup, oral syringe, or dropper should be used to ensure accuracy. To ensure complete record keeping, records of each student's visit should be logged, labeled with the time, date of visit, the school health staff's name, and the reason the student was seeking health services, the school's health staff, recommended course of action, and the outcomes of the visit. Every school should keep an individual medication log for each medication a student receives. Every time a dose is administered, the medication administrator should document the action and sign the record. If a medication is no longer needed, parents or guardians should notify the school and arrange to retrieve the medication from school property. At the end of the school year, school staff should contact parent and guardians to arrange for medication to be picked up. If medications are not retrieved from the school, you may dispose of the medications by following any disposal directions provided on the prescription label. Do not flush medications down the sink or toilet unless instructed to do so. If no disposal instructions are provided on the label, then you may remove the medication from the container and mix it with undesirable substances such as coffee grounds, dirt, or kitty litter. Place it in a sealable bag or container to prevent the drug from leaking and place it in the trash. Needles and lancets need to be disposed of in puncture-proof containers and placed in the trash. Asthma inhalers may be disposed of in the trash. Please click the link for the school district's Injury and Illness Emergency Guidelines. At the beginning of every school year, school nurses should receive from parents and guardians food allergy disclosures and forms regarding the student's health information. Parents and legal guardians are responsible for providing students' health care information. Once the student's health care information has been received by the school nurse will initiate an individualized health care plan. This document is used to document the nursing process that school nurses use to plan and provide care for students with chronic health care needs. In Texas, only a registered nurse may develop the IHP. However, the parents, teachers, and other school personnel can contribute information in formulating the IHP. The IHP is composed of the following nursing process components. Number 1, a nursing assessment. Number 2, a nursing diagnosis. Number 3, goals identified by the nurse. Number 4, planning and implementation of identified goals. Number 5, documentation of student outcomes. And number 6, evaluation of students' response and nursing care. IEPs were created because of the Individuals Disability Education Act, or IDEA. IEPs are for students who have a disability that significantly impacts educational performance or ability to learn from the general curriculum. These are offered to students through grade 12. 504s are required due to the Rehabilitation Act of 1973. A 504 is completed when the student has a disability that significantly impacts a major life function. The disability must interfere with the child's ability to learn in a general education classroom. Section 504 has a broader definition of a disability than the IDEA. The disability must substantially limit one or more basic life activities. According to the Texas Board of Nursing, registered nurses are able to delegate specific duties and certain responsibilities to unlicensed personnel. During the delegation process, the registered nurse is required to use the 5 rights of delegation. Number 1, the nurse must know if it is the right task according to the Nurse Practice Act and the job description. Number 2, the RN must determine if it is the right circumstance. What are the circumstances of the patient at this time? Number 3, the registered nurse must know if this is the right person who is competent enough to perform the delegated task. Number 4, the registered nurse must consider giving the right directions and providing the right communication to the unlicensed personnel. And number 5, the registered nurse is required to provide the right supervision and evaluation of the delegated tasks to the unlicensed personnel. Here are a list of items that the registered nurse cannot delegate according to the Texas Board of Registered Nursing. Assessments requiring RN judgment, intervention, referral, or follow-up. Formulation and initiation of a nursing care plan, or IHP. Specific tasks in the nursing care plan if evaluation of the student's response is needed. Responsibility and accountability of health teaching. Dosage calculations except diabetes. Injectable medications accept emergency medications such as glucagon and the EpiPen, medications via a non-permanent tube, medications through a permanent G-tube feeding can be delegated. Receiving or requesting verbal or telephone orders related to medication administration, and initial medication dosages. The National Association of School Nurses believes that head lice infestations in the school setting should not disrupt the educational process. Head lice is not a communicable disease, and no health risks have been associated with head lice. Therefore, no whole classroom screening is necessary. No exclusion for NITs is necessary. Parents and parent guardians will be notified. The school nurse or health staff should follow up with the family. Senate Bill 1566 requires that elementary schools notify parents of a classroom occurrence of lice. Training for nurses can be found at each of the listed websites for concussions, seizures, and reporting to CPS. ESC Region 12 offers professional development, expert support, and guidance in meeting Title IV Part A state and federal requirements, including student access to a well-rounded education, improving school conditions for student learning, and improving the use of technology to increase academic achievement and digital literacy of all students. Region 12 also offers informative updates and high-quality training to support counselors, public school health care providers, health educators, physical educators, school nurses, and other school staff members designated to ensure the health and wellness of Region 12 children. Learning and health are interrelated, and schools play a critical role in promoting the health and safety of our young people. Education Service Center Region 12 offers a number of cooperatives and shared service agreements. Shared service agreements and cooperatives are agreements between member districts and the Education Service Center. They allow schools to pool funds and receive services at a discounted rate through these partnerships. Educators who work at a campus or district that is a member of a co-op can attend training at no additional cost or at a lower cost and may receive additional direct services performed for the member districts. Cooperatives and SSAs help schools leverage and share resources, preserving more money within the classroom for student achievement. Listed on this slide are various trainings offered through Region 12.